Hello fighters, this is Dr. Riaz with another episode of Be Smart Fight Strong series of videos, and in today's video I will be talking about what are the most effective medicines that you can take to manage your nausea and vomiting. Be sure to watch my other videos related to this topic, including the tips and tricks you can do to manage the nausea and vomiting, and also the foods that you can take to decrease the risk of nausea and vomiting. Also, there is a video on the nutrition, so be sure to watch that video. So let's dive right into today's topic. Okay, so the very first medicine that I want to talk to you about is ondansetron, or the other commercial name for this medicine is Zofran. Now, this medicine is prescribed very commonly to all cancer patients, and if you are on chemotherapy or any other hard medicine that can induce nausea or vomiting, you should be having this medicine, or your doctor might have prescribed this medicine. Now, this is by far the most common medicine used for the management of nausea and vomiting in a cancer patient. This medicine comes in pill form and also in the IV injection form. Typically, the IV injection form is given in the cancer center or in a monitored medical setting. However, the pill form you can keep at home. This is a very good medicine. Again, for each medicine, the individual sensitivity can be different, but this is by far the most commonly prescribed medicine. Therefore, you should have this medicine at home all the time with you. The second medicine I want to talk about is called Finargan, and this is another very commonly prescribed medicine for cancer patients. What I typically do is that I prescribe both ondansetron and Finargan to my patients to keep at home in all those patients that I am doing chemotherapies. If you have severe nausea and vomiting, and you are caught in that vicious cycle of nausea and vomiting, and now you are not even able to take this medicine, guess what? The ondansetron comes in a small disintegrating form that you can put under the tongue, and it will disintegrate and enter into your system from the mouth. That's why you don't have to swallow the pill, and if it kicks in, it's going to stop the nausea and vomiting. Similarly, the Finargan also comes in suppository form, so therefore if you are in that bad situation where you have a lot of nausea and vomiting, you can take a Finargan suppository, and hopefully that will help reduce the nausea and vomiting and break the cycle. Then the next medicine I want to talk to you about are the long-acting medicines. Now, these medicines typically you won't be able to keep at home. However, your doctor can prescribe these medicines in his office. Now, these medications are typically given as a part of pre-medication prior to chemo, and the names of these medicines are aprepitant and fosaprepitant, and they have commercial names like Imend or Simvanti. Their effect tend to remain for about 48 to 72 hours, which is really good because that is the first 48 to 72 hours when the nausea or vomiting is really severe and you really need a long-acting medicine. Now, in between that time, you can also use the short-acting medicines, but at least these long-acting medicines remain in your system longer. Now, that brings us another important point, that sometimes patients come and they complain that their nausea and vomiting kicked in on like day 3 and day 4, and that's exactly the reason that when these long-acting medicines wears off, that's when the nausea and vomiting kick in. So for you, you have to learn your pattern at what time the nausea and vomiting happens to you, because it may be not the day 1, not the day 2, maybe day 3 or maybe day 4 in some situations. Therefore, knowing the pattern of the nausea and vomiting is very important to help you manage this problem. Another medicine is Reglan or metoclopramide. Now, this medicine is also used for management of nausea and vomiting, and this medicine is a prokinetic agent, meaning that it increases the stomach motility. And in some patients, the problem could be that the stomach or the intestines are not moving quite regularly, and all the secretions and food content, everything is kind of staying over there. Now this can trigger nausea and vomiting. It can classically happen in people who have very bad diabetes for a long time, and now they have developed what we call diabetic gastroparesis, meaning their stomach is weak and it's not pushing it forward. Now if that condition applies to you, maybe you will benefit from using Reglan, which is another option, and in the right clinical setting can benefit a lot of patients. Next medicine I want to talk about is the steroids. Now steroids are medicines which are used for many reasons in cancer patients. Sometimes they are part of the chemotherapy regimen in which the patients are pre-medicated with the steroids, and there are several reasons for that. One of the reasons is to prevent allergic reaction. Another reason is to stop the nausea and vomiting. Therefore, steroids are powerful medicines that you can use to decrease the nausea and vomiting. Now, as I said, a lot of times your doctor might give you on the day of chemo. However, if you have tried other medicines that I described before and still the nausea and vomiting has been an ongoing challenge, this is something that you can take at home. The problem with the steroids is that they are supposed to be used for a short term, meaning for days to weeks, and if you try to use them every day or consistently for a long time, there are a lot of side effects that can come with them. Therefore, this medicine is usually reserved by doctors to be used as a short term, and especially in the setting of nausea and vomiting, we use this medicine when our other medicines are not working. Another important steroid effect is that it can boost your appetite and it can boost your energy level. Another medicine that sometimes doctors use to stimulate the appetite is the medical marijuana. Now, this medicine has also some effect on the nausea and vomiting. So, in the right setting where you have used other treatments but they are not working good, this medicine can be tried. Medical marijuana, your doctor can prescribe you, and you will need a prescription to get that from the pharmacy. These days, CBD oil is available in the market. It is legal all across 50 states. And in my experience, it's a 50-50 shot at CBD oil helping with the nausea, vomiting, or boosting your appetite. But if nothing else is working, then trying the CBD oil is very reasonable in that situation. Another holistic approach with no downside is the acupuncture. And again, not everything works in everybody, and if you have tried all the medicines, you have tried all the other techniques, then you can try acupuncture. The last medicine I want to talk to you about to manage the nausea and vomiting is the anxiety medicines, which are classified as benzodiazepines, and there are several different types of them. There is diazepam, lorazepam, and some other medicines in this category. And this is anxiety medicine or a sleeping aid, but one of the effects that we have observed is that it can also control the nausea and vomiting, and your doctor may try this medicine if nothing else is working on you. Okay, dear fighters, that's all I have today in today's video. I would love to hear your feedback, so feel free to ask any questions and send your questions to ask@onlineoncology.com. And I would really like you to spread the message if you find value in this video. There are many people out there who are struggling with this problem. Therefore, keep spreading the message to those people. Be smart, fight strong.